Councilmember Ritchie Torres has joined us. Earlier on Tuesday, he informed the world that he had tested positive for COVID-19, the coronavirus. And so, first of all, Councilmember, how are you feeling? And then we'll go through some of the other issues that are involved in this. But first of all, how are you?
I'm actually feeling fundamentally fine. I've been largely asymptomatic. I've been principally concerned about my chief of staff, who began to develop serious symptoms on Saturday. He went to a doctor, underwent testing, and then came to discover that he had the coronavirus, which prompted me to undergo testing on Monday. And that evening, I found out that I had the virus as well. And so upon finding out the results of the test, I subjected myself to a self-quarantine at home. I directed my staff to do the same in order to avoid spreading the virus to others. I have a 60-year-old mother with chronic conditions. People like my mother are particularly vulnerable to the novel coronavirus. And I owe it to them to remain at home and ensure that I'm doing my part in social distancing.
Are there others on your staff who are not well, or it's really all out of precaution?
I'm largely acting out of an abundance of caution. The only person who has shown significant symptoms is my chief of staff.
I guess, you're a council member. You've been dealing with this on official levels, and it hits home, doesn't it, when not only your chief of staff, but yourself, and certainly then you become aware of people around you. It's probably very easy to think it's going to happen to somebody else, but there probably is a pretty hard, drop to the ground of reality here. Can you describe at least what you're thinking about and what your emotions are through this whole process?
Look, it's unsettling for me. I oversee both the congressional campaign staff, and a council staff. And so my own life is a case study in how rapidly and widely a disease could spread. I'm responsible for the well-being of about 20 people, and each of those 20 people have social networks, have families. And so I want to see to it that all of them are isolating themselves at home and are practicing social distancing. The pandemic is the greatest crisis, the public health crisis that we have all faced in our lifetimes.
Right.
And we have an obligation not only to ourselves to avoid contracting the virus, but we have an obligation to others to avoid spreading the virus, especially to those who are elderly, to those with compromised immune systems or chronic conditions. The mortality rate of coronavirus for those at or above the age of 80 can be as high as 15%. And so the only hope,
significant.
It's alarming. And so the only hope for slowing the spread of the disease is aggressive social distancing, remaining at home. We have to learn from the experience of Italy, because if we fail to mitigate the spread of the virus, then the sheer number of coronavirus cases will crush the healthcare system. We have a limited supply of beds and ventilators and surgical masks and ICUs. We cannot afford the shock of thousands of new hospitalizations. The Italian healthcare system is so overwhelmed that most people are poorly cared for, and people have been left to die in crowded emergency rooms. Right? That is a nightmare scenario that we have to prevent from unfolding here in New York City. So, it's uncomfortable for me to be a prisoner in my own home. It is uncomfortable to be insulated from my own mother for 2 weeks, but it's necessary. It might be painful in the short term, but social distancing will save lives in the long term. It will bend the curve, and it will slow the spread of the virus at a level that the healthcare system can absorb. Because what matters is not only the personal risk to us as individuals, what matters is the risk to the system itself, right? Our economy, our society, our government, our healthcare system. That is what is at stake. We have to protect the stability of all those things.
I think a lot of people have heard the mayor today and the governor deliberating over, whether they were going to, in essence, close the city and urge, people to stay at home. Can you describe a little bit what it's like to, be quarantined in this way? Do you have enough groceries? Toilet paper has been kind of a running joke, so to speak. Of course, it's not funny. Explain how it works. Like, what do you do when you're quarantined?
It's a new experience for me. I'm a single adult. I've asked my mother to quarantine herself in her own apartment because she's particularly vulnerable. So I'm essentially on my own. And I will confess to you, I did not expect to be quarantined. I did not expect to have the coronavirus. So I have not stockpiled. I've been mostly relying on deliveries. So I will confess that I'm ill prepared for the coronavirus outbreak myself. But I'm going to make the best of the situation. And to be honest with you, Gary, I'm not worried about myself. I'm worried primarily about the senior citizens who are at greatest risk of mortality. And I'm worried about the families and the businesses that have lost their livelihoods because of the economic and human toll of the epidemic.
Just one more question then about it. So, because I think many people will say, gee, if I'm going to do this, what would I have to do? So you order, let's say, which you can do now, of course, groceries. You can order that way. You can certainly order dinner. And do they come to your door? You tell them to leave it at the door? I mean, how does that work?
Yeah, so I will go outside my house with a mask on and have them just drop it off right there, and then I'll pick it up. And I avoid contact because keep in mind that, coronavirus, once you open your mouth, you release respiratory droplets that can travel in the air up to 6 feet. So you want to maintain more than 6 feet of distance from people to ensure no infection.
I hate to ask this question. Were you able to get testing even for others in your office because you are a council member and have, frankly, connections? Or were you in a similar situation as, frankly, anybody in the general public who said, hey, I think I may be in contact and I need to get testing?
Look, I don't know the answer to that question, to be honest. I mean, there's been a severe shortage of testing because of the dysfunction in the Trump administration. I think each person has his or her own story about testing. Some people have been able to obtain testing expeditiously. Some people have had trouble obtaining testing. So the experience varies widely, depending on the individual, depending on the health system. All I can tell you is I received exceptional care from Montefiore, but I would have never received testing were it not for the fact that my chief of staff, A, had exhibited clear symptoms, and B, had tested positive for the coronavirus himself.
Right.
And as a public official, I come into contact with more people than most people do.
Right, especially running a campaign, let's face it.
I oversee a campaign staff. I oversee a district office staff. I oversee a legislative office staff. I oversee an investigative staff in the city council, not to mention the countless interactions I have with constituents. There could be a situation in which the city council might ask us to come into a stated meeting and cast an emergency vote. And I do not want to go outside unless I'm assured that I'm free of the virus. Now that I've tested positive, I have no choice but to confine myself to my home for 2 weeks for the sake of public good.
I've got one question left, sir. We only have another minute.
I'm sorry about that.
No, that's okay. Listen, you and I, we've had a number of programs. We could talk for a very long time. I live in an apartment building in the Bronx. We have maybe 85 families in this building. I'm thinking that the odds are somebody in this building, maybe without knowing it, is positive. And that's why even touching the door handles when I leave the building, or in the, touching elevator buttons, careful to wash my hands, careful to make sure not to touch my face. I'm assuming you agree with that sort of analysis. It seems obsessive, but in this day and age, and this situation, I think you have to do that.
Look, if you wash your hands and you avoid touching your face, then those are the best safeguards against contracting the disease, because the membrane of the coronavirus dissolves upon coming into contact with soap or disinfectants or hand sanitizer. So as long as you're avoiding contact with your face, and as long as you're washing your hands, you should be protected from the infection. But I want to make this point. You know,
Okay, do
I'm
it
young.
quickly, 'cause
I'm
we're
a
gonna
mo-
run out of time.
I'll do it quickly. There are thousands. I suspect there are thousands of young people like me in New York City who are carrying and spreading the virus without even knowing it. So we all should be acting as if we have the virus, and we all should be remaining home in order to avoid spreading it. And those are my last words.
Council member, I know on behalf of Michael Maxnabi at BronxNet and all our producers and everybody here, and frankly, everybody in your council district and in the borough of the Bronx and everywhere, we wish you and your staff good health, and let's all do the best we can to stay protected. And we appreciate you taking some time with us here on BronxNet Television.
Always a pleasure, Gary. Take care. Good luck out there.
You too, my friend. All the best. All right, let's send it back to Darren.